ventilator or a breathing machine. Across our healthcare system, approximately 45% of hospital beds, 39% of our intensive care unit beds, and nearly 73% of our ventilators are still available. As the weather starts to get warmer and some parts of the state are able to go from red to yellow, to reopen, so to speak, we know that individuals will be spending more time outdoors, and that's great. But it's essential that we remind all Pennsylvanians of another public health threat that can affect people of all ages, and that's Lyme disease. Lyme disease is a serious health issue that can impact your overall health. It can affect the heart, the nervous system, and the joints, and it can lead to serious complications if it's not diagnosed promptly and treated promptly. Lyme disease, as we know, is spread through tick bites. Each year, the number of Lyme disease cases in Pennsylvania is among one of the highest in the nation. It's why it's so important to protect yourself, your family, and even your pets from tick bites when you are outside. People typically think that ticks only live in high grass, heavily wooded areas, in areas with a lot of leaf litter. However, ticks can be found in your backyard, around your neighborhood, and in urban areas too. The best way to protect yourself from a tick bite is to cover exposed skin with lightweight clothing, use insect repellent containing 20% or more of DEET, D-E-E-T, and do a tick check. Immediately check yourself, your family, your children, your pets for ticks after being outdoors. Symptoms of Lyme disease can include a bullseye-shaped rash, but it doesn't have to be exactly bullseye, and not everyone gets the rash. It also includes fevers, chills, headache, tiredness, and fatigue, muscle aches, joint aches, and swollen lymph nodes. If you think you have been bitten by a tick, you can contact your healthcare provider. Being proactive will help protect us against a number of diseases and viruses that can impact your overall health, including Lyme disease. Now, here are my daily reminders. Wash your hands with soap and water for at least 20 seconds, or use hand sanitizer if soap and water are not available. Cover any coughs or sneezes with your elbow and not with your hands. Don't touch your face, especially after touching surfaces. And clean surfaces frequently. And if you have to go out for life-sustaining activities, please wear a mask if you're going to come into contact with others. If you have questions about your health, please contact your healthcare provider. And if you need mental health resources because you or someone you know is experiencing a mental health crisis, please contact the crisis text line by texting PA to 741-741, or call the statewide support and referral helpline at 1-855-284-2494. Again, 1-855-284-2494. For the most reliable information related to Pennsylvania's response, please visit our website at health.pa.gov. And what is always most important for Pennsylvanians to remember is stay calm, stay home, and stay safe. And now I'm pleased to answer questions.
Thank you, Secretary. From the Philadelphia Inquirer, are Pennsylvania residents that are still under a stay-at-home order permitted to travel to the Jersey Shore beaches that are reopening? Is it safe for them to do so, and will there be any enforcement in regards to travel to shore beaches?
Well, there is no enforcement against travel in Pennsylvania or between states. So there's no law or regulation that prevents travel within Pennsylvania or between Pennsylvania and New Jersey. My recommendation, however, is not to do that. I know it's tempting given warm weather that hopefully will be coming soon, but going into New Jersey can have risk because New Jersey has had a very high incidence of COVID-19. And if you go to the shore, I bet you other people are going to go to the shore, and then it'll be almost impossible to practice social distancing. And so my recommendation is for people to stay home.
From the Altoona Mirror, regarding the proposed expansion of testing, If a person is asymptomatic, how likely is it that they would test positive, and how likely is it that they are contagious to others?
Well, so at the moment, we are still prioritizing testing for symptomatic individuals. Now, previously, we had actually been more stringent than that, but we have really recommended testing for all symptomatic individuals for COVID-19, those with fever and cough and shortness of breath, but other symptoms, we talked about chills and shaking chills, etc. We are not pushing out population-based testing at this time. We might in the future, and that would be widespread testing of asymptomatic people. We do know that asymptomatic individuals can have COVID-19 and can spread COVID-19, but we don't really know how many asymptomatic people there are in Pennsylvania and what percentage or what chance you would have of having COVID-19 if you have no symptoms.
From ABC 27, we've had viewers ask us the following question, and we're hoping for a clarification. If masks work, why do businesses need to close? Or if they don't work, why do people need to wear them inside businesses that are open?
Well, the issue is that masks work, but they don't work 100%. So we have always said that my mask protects you and your mask protects me, but these are not the N95 masks that healthcare personnel use when they're taking care of patients with COVID-19. These are cloth masks. Cloth masks are not infallible, and so even though there is protection, it's not 100%. And so that has led to the mitigation and prevention measures that the governor has taken. And overall, the goal was to bend the curve, to flatten that curve. We were successful in doing that. We did not overwhelm our healthcare system, but we have to be careful in the future because COVID-19 is not gone from Pennsylvania and can resurge again, and is still very prevalent, unfortunately, in the southeast and the northeast. But we are making significant progress, and therefore, tomorrow, actually, 24 counties will go from the red zone to the yellow zone in the governor's phased reopening plan.
The Lewistown Sentinel and WTAJ have questions about SCI Huntington. Currently, SCI Huntington is reporting 109 total cases of COVID-19. The Department of Corrections is reporting 108 inmates and 32 staff have tested positive. Does this mean that virtually all of Huntington County's COVID-19 cases can be attributed to the prison? And if so, how would this impact Huntington and surrounding counties, especially with chances of moving into the yellow phase of reopening?
Well, we're looking at all that data, and we'll see how all the numbers look. I don't have the numbers in front of me, but we have always said is that long-term care living facilities, that correctional institutions and other areas that have COVID-19, such as food processing or manufacturing plants, et cetera, do count in the county's general count of COVID-19 patients.
From the Scranton Times-Tribune, citizens in Wyoming County today protested their ongoing red phase status. They point out they've had only 27 cases, remain well below the 50 per 100,000 two-week threshold, and should be treated like neighboring Sullivan and Bradford, which go into yellow tomorrow. Meanwhile, Clinton County, which also will go into yellow tomorrow, has never dropped below the 50-case threshold.
Well, we're going to be looking at all of that data, as we said, and then we'll be presenting recommendations to the governor, who will make his decisions.
From Capitol Wire, like past reconciliations, can you say how many deaths would have been reported today without the reconciliation and how many were due to the reconciliation? Again, if this question can be answered after the press conference if you don't have granularity.
I don't have that granularity in front of me, but we can send that information to the reporter after the press conference. But I want to emphasize that we are all really spending a lot of time working to reconcile that data. Our department is working daily now with the Philadelphia Health Department in terms of reconciliation. We're working on personnel and IT fixes in terms of other reconciliations, and we want to make sure that we have the absolute most accurate data possible for Pennsylvania.
From the Scranton Times-Tribune, the percentage of population tested in Montour County far exceeds that of any other county, even though the county only has 50 cases. Is it simply because of the presence of Geisinger Health System, or is there some other reason? And if it is Geisinger testing people multiple times and reporting them?
I don't have granularity about Geisinger's testing system, but I think it is fair to say that with a large academic medical center and tertiary care medical center, that there is more testing.
From WNEP, Rite Aid just announced it will begin testing asymptomatic people at its testing sites in Pennsylvania and elsewhere. When will the state do the same at its testing sites? And should hospitals do the same at theirs?
Well, so, I mean, Rite Aid is part of our testing sites. So, we are building an eclectic array of different testing possibilities for Pennsylvania. We want to make sure that it's accessible. We want to make sure that it's available to people to get tested. So that is going to include testing that we do. For instance, we still have the two mass testing sites, one in Montgomery County and the other in Luzerne County in Wilkes-Barre. Actually, those tests go right to our laboratory in Exton. Exton is still doing samples that we prioritize for healthcare workers and long-term care living facilities and hospitals, et cetera. But then actually hospitals and health systems are doing the majority of testing in the state. They are either performing those laboratory tests at their own hospitals, or they're sending them out to LabCorp and Quest, which still do a large number of tests. And then we have Rite Aid, which will be obtaining the tests and then sending them to a commercial laboratory. So we are looking for to partner actually with other companies and other pharmacies as well to do a great job. And so we're going to have an eclectic group of different places that people can get testing.
From Penn Live, do you have any advice for people who might be considering visiting their mom despite the restrictions? What if they think it's no big deal or no reason to forego the visit? What guidelines can you give to visit mom safely?
Well, I know that Mother's Day is coming up, and so my recommendation, however, in the red zones is to do that visit virtually. The safest thing that you can do for yourself, the safest thing that you can do for your mother and your family and your community is to do that visit virtually. In the yellow zone, I think that people could do visits, but not to a nursing home or a long-term care living facility. I mean, if you're going to go to their home, we are not allowing visitors in any type of nursing home or long-term care living facility or personal care home. They still have to be locked down because of the severe risk of spread in those settings.
From WQKY, can someone be transferred from a nursing home where their roommate is tested positive for COVID-19 to a family home or another nursing home? And if so, what guidelines are given to a family members accepting the nursing home resident?
Well, if a family accepted a nursing home resident, if there were cases of COVID-19 in that facility, then really everyone would need to be quarantined for 2 weeks. And so if your loved one was in a facility where there was COVID-19 and that person tests negative but has been in that facility, and you decide to bring that person home to take care of them, then the entire household should be quarantined for 2 weeks.
From WKOK, we've learned that the CDC detailed a guide to reopening the country has been shelved by the Trump administration. What are your thoughts on that, and does it mean that businesses will have fewer guidelines to concern themselves with as we reopen?
Well, I'm not really going to comment on the Trump administration's actions. I want to say that we collaborate very closely with the CDC. We have been looking at their guidelines, and when they meet with our guidelines and our expectations, we often use them. Occasionally, we might go in a different direction. It's kind of hard for me to comment on what the federal government and the White House is going to do.
From Lehigh Valley Live, we know the department wants to expand testing to get more accurate accounting of the virus. But if only the sickest people are currently being tested, how does the state factor into those decisions now?
Well, we want more than just the sickest people to be tested. Previously, even a little more than 2 weeks ago, when laboratory testing was still more restricted, when we didn't have enough supplies, we were prioritizing that testing to long-term care living facilities, to hospitals, to seniors with symptoms over 65. However, now that we have more testing capability, we have more reagents, we have more swabs, not just us in our laboratory in Exton, but the hospitals, the health systems, the commercial laboratories. We want to expand testing to all symptomatic individuals to get a better idea of how many patients have COVID-19.
From WHYY, how long has the Pennsylvania Department of Health been using the MITRE-SARA Alert Contact Monitoring application, and how has it been working thus far?
Well, we actually have started using it in the last day or so. I believe we've had our first two patients that are part of the system, and in its first or second day, it's going great.
From WHYY as well, how far along is the health department when it comes to examining Bluetooth notification technology? And is the department using the Google, Apple API, some other vendor, or developing its own?
So we are looking at the different types of Bluetooth technology now. I believe we're getting very ready to work out a contract with them, and then we'll announce it.
From News Talk 104.1, yesterday you provided legislative leaders details on COVID-19 cases, including 84.4% of the 3,106 deaths had at least one, and as many as 4 comorbid conditions at the time of death. Is it fair to say that those people died of something else and tested positive or were probable for COVID-19?
No, what we're saying in terms of that data that we provided to the legislative leaders upon their request was that it is very clear that seniors are most at risk of getting COVID-19 and having a very serious case of COVID-19, possibly leading to death. And those with comorbid conditions with other types of medical conditions are even more at risk of contracting COVID-19 or having a very serious case and tragically passing away. So that includes, those comorbid conditions can include heart disease. An example would be congestive heart failure. That it can include uncontrolled hypertension. We're also talking about chronic lung disease, such as chronic obstructive pulmonary disease. That includes chronic bronchitis and emphysema, and chronic kidney disease, so those type of conditions. Some seniors might have one of those conditions. It's not uncommon to have multiple of those conditions, and that forms the basis of the data that we shared with the legislature.
From WGAL, the number of new cases is up. What is your reaction? Is the trend over?
Well, one of the reasons that the number is up is that we had a quote-unquote data dump. We had a whole bunch of different results come back from LabCorp, one of our commercial laboratories, and so that tends to skew things. So we're going to see what the numbers are tomorrow and then over the weekend and into next week to follow trends. Overall, the number of new cases over time continues to go down. We know today's was a little over 1,000. We'll see how tomorrow's is.
From the Daily American, while we know that the virus sets the timeline, what is your outlook as we look forward to the fall as far as social distancing?
Well, I'm a positive and optimistic person, and I think that we're going to be successful in our battle against COVID-19 in Pennsylvania and in the United States. That being said, it's very hard for me to predict what the fall is going to look like. There are a number of public health officials and infectious disease experts that are very concerned about a possible significant increase of the virus in the fall as the weather starts to get colder. That'll be the same time that we start to see influenza, and so we're going to make sure that Pennsylvania is ready.
From Fox 43, over the last couple of days, the department has given us numbers for the COVID-19 cases among healthcare workers. You've also provided COVID-19 cases of nursing home, long-term care, and employees. Are those two separate numbers, or are the nursing home employees' cases included in the overall healthcare worker cases?
The nursing home staff cases are included in the larger healthcare worker statistics.
From the Pittsburgh Post-Gazette, some parts of the country, such as the state of Kentucky and some counties in Florida, have opened up drive-through testing sites to anyone who wants a test. Why is this not more widespread, and will Pennsylvania do this?
Well, we're considering all of our testing criteria, but we want to make sure that we test people who have symptoms. Again, if we're going to be testing large amounts of asymptomatic people, we want to do that in a systematic surveillance driven way to get a sense of the total burden of COVID-19 among people in Pennsylvania. But we want to do that in a scientific way.
From News Talk 104.1, Secretary Levine, earlier this week, the Monroe County coroner expressed frustration with you and the department in a letter to Governor Wolf, and the letter sought your resignation. What is your reaction to the letter?
Well, I actually haven't seen that specific letter, but we are actually working with the county coroners. We had a phone call last week with them. We're going to be arranging another phone call to try to make sure that with the Coroners Association, with the president and the executive director and other coroners, that we work very, very closely with those excellent professionals. In terms of asking for my resignation, I always serve at the pleasure of the governor and will continue to serve under his leadership as Secretary of Health.
From the Scranton Times-Tribune, is Rite Aid testing somehow getting counted in the state numbers?
Yes. So Rite Aid would be doing a test. They actually don't perform the laboratory analysis in their store. They are obtaining the specimen and then sending it to a commercial laboratory, and all of those results are inputted into our data system, NEDS. From
Penn Live, with places such as auto racing and dirt tracks like Salinsgrove Speedway in Snyder County and horse racing tracks like Presque Isle in Erie County be able to operate in counties that reach the yellow stage?
I don't have specific information about those facilities, and so I know that there is guidance coming out from the governor's office, and so we'll wait to see what their guidance is.
The Altoona Mirror and WGAL have similar questions about reopening. Given that Governor Wolf said today that he will announce the next round of openings tomorrow, can you say when the next opening will occur? And in the next round, will there be counties opening independently of the health district groupings?
Mm-hmm. So all of that information will be released tomorrow at the governor's press conference.
And our final question today is from WNEP. For Dr. Levine, we've heard from several dentists regarding when will they be allowed to reopen for routine procedures. If the state says it's okay to open dental offices, does that decision also reflect what CDC and OSHA are recommending?
Well, we have reviewed the CDC guidance and OSHA guidance, and we're putting out all together, and we hope to have that released by the end of the week, which should be tomorrow or Saturday.
Thank you so much, Secretary. That concludes our briefing for today. Our next briefing will be tomorrow.